Big business of healthcare. Steward Healthcare Systems is on the fast track to expansion, growing to manage 36 hospitals in 2017, becoming the largest privately owned hospital operator in the country. Joining us right now is the founder, the chairman, and the CEO of Steward Healthcare Systems, Dr. Ralph De La Torre. Dr. De La Torre, it's great to see you again.
Great to see you again, Maria.
And we were just talking during the commercial break that your company has tripled in size just since the last time you joined us on the show.
It has.
Congratulations on these acquisitions.
Well, thank you, I think.
How's it going in terms of integration?
It's going well. I mean, I think that we set some very, very important targets for us to hit, and I think we're hitting them. We've consolidated dramatically already the first 4 months, and then we'll take the rest of 18 to do the rest of our consolidation, and by 19 we should be fully integrated across the entire U.S.
At this point, do you think the consolidation is largely done? I mean, the low-hanging fruit has taken place, whether it's your company or others. Are there other hospitals out there that need the scale to best compete?
So I think in the hospital horizontal, there's a little bit more consolidation, especially in the nonprofits that's happening. I think what we're starting to see now is markets consolidating along the vertical. So, hospital companies that want to be not just hospitals, insurance companies that want to be not just insurance companies, to really take care of the patient across the entire healthcare vertical.
And what does that give you, being a better hospital group? I mean, obviously, you've got the scale, and I guess you can have much better efficiency. But what are the other positives from a patient standpoint?
Well, from a patient standpoint, the real positives come in vertical integration, right? Because we always, in business, think of horizontals, right? There's hospital industries, there's physician companies, there are insurance companies. But patients don't consume healthcare that way. They consume it up and down the verticals, right? A patient doesn't always live in the hospital world or in the surgery center world or in the payer world. And I think what you're starting to see now is an acknowledgement that for us to really be a service industry, the way we should be for patients, we have to consolidate vertically and provide the entire vertical of care.
Let me ask you about the policies coming out of the administration. Obamacare, obviously, the administration is now proposing to ease regulations on small businesses that team up to buy insurance through association health plans. You also have the individual mandate being eliminated in this latest tax plan, which, of course, was signed into law. What are the impacts?
Well, there's a lot of impacts. I think that the important thing to understand is that we need to reform healthcare. We don't need to just change the way that we pay for it. And if you think of it, healthcare is not really an exercise in public policy. We pretty much fundamentally agree that if we have the money, we'll give the healthcare to everybody who needs it. Healthcare is an exercise in public finance. And as such, you needed to treat it as a business venture. So, for example, the way that it needs to happen is we need to ease the regulatory scheme across all sectors and all healthcare industries to make the actual cost of the components cheaper. Then we need to integrate it in a way that benefits the patients and cuts down the inefficiencies of going from one sector to another. After that, we really need a society to figure out what's the right amount of health care. Because now we know the cost. We have to multiply it by the total amount. What's the right amount of health care? After we've gone through that exercise, then we figure out who pays for it and how. We always jump to the last step without tackling the first 3 steps, and we're setting ourselves up for a financial disaster.
But the individual mandate going away, that seems to be a good thing for people. They don't have that alleviation anymore. Is that wrong?
Yeah, I think it depends on how you look at it from a timing. From a short timeline, yes, it's effective for patients. It helps small businesses. But remember, at the end of the day, any health care that patients don't get now, any care that isn't given to them, we as taxpayers end up paying for it later, right? People forget the majority of health care is provided through Medicare and Medicaid. So we need to be cognizant of that, and we need to take care of those patients. It's also very destabilizing. I mean, everyone talks about, well, the young and the healthy shouldn't be paying for the health care of the sick. Well, there's no other way around it. You have to. If not, the burden of the cost is too high, and you either deny care, which I don't think anybody wants to do, especially to our senior citizens, or it sinks us to taxpayers.
But weren't we seeing a situation where people didn't want to swallow that cost, so they were just paying? I mean, they didn't want to swallow the cost of actually health care, so they were just paying the fee not to not have insurance.
Right, and you're exactly right. It comes back to step 3, which is we as a society need to decide what's the right amount of health care and how we're going to then tackle it in step 4. It's important that we come to those decisions as a society, because if not, you're right, people are just going to opt out, and it destabilizes the entire cost structure.
We have news this morning, Celgene acquiring a blood disease biotech company, Impact Biomedicines. This is a $7 billion deal. How do you see this, the future of healthcare in the United States, changing as a result of some of these tuck-in acquisitions that we're seeing in the blood area?
Yeah, so I think those are important acquisitions, and furthering healthcare and innovation is crucial. It's crucial to our future. But that's not where the low-hanging fruit is, right? The low-hanging fruit for us is not in those kind of disease, is in providing prenatal care, is in making sure that we're efficient and low cost and for everything we do, from births to heart surgery to hernia surgery. That, I think, is the low-hanging fruit that we need to tackle. And I think that we as a society are fascinated with the glamour. I mean, look at last night's red carpet, right? Yeah. And so, but that's not where the impact is in the next 5 or 10 years.
What do you see driving healthcare? I mean, we're living longer. Obviously, longevity and wellness has become more important than ever for people as we're seeing people live longer and longer. What's driving your business right now?
Well, I think what's actually driving and motivating our business is finally our entire healthcare services sector is coming to the realization that the patient is at the center, right? For a long time, we've been catering to employers and businesses and government and doctors and nurses. Now we're all of us, physicians, nurses, employers, coming to the conclusion that it's the patients at the center, and we need to restructure and reorganize the way we provide healthcare for the benefit of our patients.
Well, I mean, you would think that the patient is at the center of it. In terms of driving your business, though, the bottom line, what is it?
For driving the bottom line, it's wellness and prevention. I think we're finally coming to the conclusion that we need to provide wellness and prevention and keep patients out of high-cost encounters.
Are people understanding that? I mean, are they changing the way they live as a result of that?
You know, they are slowly but surely. But again,
we are living longer.
Yeah, no, but remember, we're a society that wants to believe that you can do anything you want, lead life the way you do, and then at the end of the day, someone will put the pieces back together. And I think the later generations are starting to understand that that's just not the case.
You previously were the chief of cardiac surgery at Beth Israel Deaconess Medical Center. What can you tell us about cardiology? I mean, heart disease is still the #1 killer.
So I think actually it's come a long way. If you look at both pharmaceuticals, if you look at interventions, it's made dramatic progress in the last 2 decades. Everything from the Lipitor, the statins, to the stents. And I think it's going to continue to make progress. At the end of the day, cardiology, cardiac care, all comes from prevention, wellness, eating correctly, keeping your blood sugars under control, keeping your lipids under control. That, coupled with the pharmaceuticals, I think we've made and will continue to make dramatic steps in that.
We were just talking about that a moment ago because of the mapping of the genome. I mean, we learned so much in terms of what leads to heart disease.
Absolutely.
And we've changed our behaviors.
Yeah, but we've actually known, a lot of those things, dating back to the Framingham Heart Study, and knowing them and understanding them and actually doing something about it as a society are very different.
Ralph, it's great to see you this morning.
Good to see you, Maria.
Thank you so much for joining us. Dr. Ralph De La Torre joining us there. We'll be watching. Thank you so much.